see for my patient. Hi Gretchen, my name's Amy. I'm your student nurse today. My patient is unresponsive, so now I'm going to check her wristband for her patient identifier, and her name is Gretchen Weimers, and her birthday is 10/22 of 1990. All right, so because we've had some complaints of Gretchen being agitated, and right now I can hear that her breasts are kind of rattled, that all leads to the conclusion that she'll probably need trach sectioning, but also that her respiratory rates are a little low. They're at 10 breaths per minute, where they should typically be between 12 and 20, and her heart rate is elevated to 105, where that is typically between 60 to 100. So now I'm going to take her pulse ox. Which is also low. It's at 94, where we typically like to see that between 98 to 100. I'm going to leave the pulse ox on the whole time. Gretchen, we're going to do some trach sectioning today, okay? So I'm going to place this little cloth underneath to catch any secretions that may come out during this procedure, okay? So this whole time I'm going to have you breathe deeply and cough, okay? Anytime you feel like you need to cough, go ahead and do it. That's going to help release that mucus and let us suction it up. All right, I'm going to increase your oxygen to about 100% more than what you're at right now. I'm going to hyperoxygenate you, take a couple of deep breaths, and I'm going to turn on this pressure. Go. All right, Gretchen, I'm going to lay that by you, okay? Keep deep breathing. All right, so I'm going to pour the saline solution into the trash can to lip. And then pouring some into my basin. And then going to open up my sterile field, only touching the edges of the paper, about an inch each side. Dominant hand, and take my catheter out. All right, with my non-sterile hand, I'm going to grab the suction tube and attach to my catheter. And I'm going to suction a little bit of the saline solution and checking for pressure, which is between the 100 to 200 range, which is normal. Great. All right, Gretchen, are you ready? I'm going to take your oxygen away, so if you would like to take a couple of deep breaths for me before we get started. Great, and just a reminder to keep coughing if you feel like you need to, all right? I'm going to place the catheter into the trach until I feel resistance, and then suctioning and twirling the catheter intermittently all the way out, and placing our oxygen mask back on. I'm going to suction more saline solution to wash away the mucus that was sucked up. And I'll wait 30 seconds before suctioning again. Gretchen, if you want to take a couple more deep breaths, we're going to do suctioning. Great. feeling the resistance, and then suctioning intermittently as I twirl the catheter out. Placing oxygen back. And sucking the saline solution to clear away the rest of that mucus. I'm going to check her pulse ox. Her pulse ox is now 98, which is in the range that we typically like to see, and her rattling has seemed to go away. I'm going to detach the suction away from the catheter and remove my glove with the catheter inside of it and throw away. I'm going to turn off that and lower oxygen. This seems to have fallen. There you go, Gretchen. All right. From here, I'm going to remove the sterile field. I'm going to keep the saline solution out. All right, Gretchen, since you did a bit of coughing, I'm going to use a sponge swab to clear out those secretions from your mouth, okay? Swabbing the mouth after trach suctioning makes sure that pneumonia is reduced, or the risk for pneumonia. I'm going to dip the cotton swab into my glass of water. All right, Gretchen, are you ready? I'm going to swab your mouth. Taking care to go back and forth and around the mouth and clearing out those airways. Great. All right, the next thing I'm going to do, Gretchen, is clean that trach area with a cotton swab and saline solution. So I would remove the gauze that's around the trach at the moment and throw it away. And then I would clean the skin around the trach with the cotton swab. And then replace with a new gauze. All right, Gretchen, I'm gonna listen to your lung sounds. So there's quite a bit of lung sounds that we have to do. And every time I move to a different area, I'm gonna have you take a deep breath. So if at any time you feel like it's too much, just let me know and we'll take a break. All right, deep breath. Good. And there are 10 lung sides on the front portion that we're listening to. Good. Breathe. Good. Breathe. Breathe. Last two. Good. Listen to the floor on the side. Breathe in nice and deep. the 8 sounds that are on the back. And at this moment, her lungs sound nice and clear. If they do start to be rattling again, we would either resection the trach, otherwise we would replace the trach for a new one. All right, Gretchen, here's your call light. Do you need anything from me? Great.